Liposuction can definitely be combined with a buttock lift, but combining a tummy tuck along with in the same procedure is not really a good idea. Hi, I'm Dr. Mrinalini Sharma. I'm a plastic and cosmetic surgeon operating in Estiva Cosmetic Clinic, Sake. So continuing with the series of FAQs, today we're going to be answering the most common queries we receive on body contouring on our social handles. So the first question is by Akshita Anand, and she wants to know, can I get body contouring done if I'm overweight? So Akshita, that's a very good question. Now, body contouring surgeries are essentially not meant for weight loss. So it's okay if you're above your normal body weight by a few kgs, but you should not be grossly overweight if you're contemplating this procedure. And ideally, body contouring aims at shaping your body, at making you lose inches rather than actually making you lose weight. So if you are planning such a procedure, be sure that you're quite close to your ideal body weight, and only then can we help you with these surgeries. I hope that answers your question. So the next question we have received is by Amit Ramanujam, who asked me that, is body contouring surgery mandatory after pediatric surgery? So yes, Amit, body contouring surgery does become mandatory after a bariatric surgery, because bariatric surgery essentially helps you to shed all those extra pounds, but you are still left with loose skin, and this loose skin can be over your tummy, over your chest, over your arms, over your thighs, or over your back even. So yes, if we were to give you a good shape, then we need to take out all that excess skin from all the areas which I've mentioned above. And this might be done in multiple stages as per the requirements and also as per the amount of excess skin which we need to excise. So we'll be combining 2 or 3 procedures together, and maybe you would require about a couple of sittings to get all the procedures done. Then the next question is, Asha is asking me whether it's safe to combine a liposuction, a tummy tuck, and a buttock lift. So combining surgeries is basically decided by the plastic surgeon, because it depends a hell lot upon how extensive each procedure is going to be and how fit a candidate you are physically. So if it's a small amount of liposuction, then yes, it can be combined with a tummy tuck, and as you asked, also with a Brazilian butt lift. But here you can have some problems in the post-op period, because positioning becomes important, especially if you're combining a tummy tuck with a buttock lift procedure. Then what happens is, in a buttock lift, we ask the patient to lie on her face for some time so that the fat which we have put into your butt doesn't get displaced. So it is practically difficult for the patient to find a position of comfort, because if you do a tummy tuck, then it's going to be difficult for you to lie on your face. And if you've done a Brazilian butt lift, or a buttock lift as we call it, then we will not be allowing you to lie on your back. So we should space out procedures. Liposuction can definitely be combined with a buttock lift, but combining a tummy tuck along with in the same procedure is not really a good idea. So the next question is by Arpita, who says, I'm 31, I have tummy fat, but I'm confused whether liposuction or the tummy tuck is the ideal procedure for me and which will give me the best result. So Arpita, it all depends on whether you have skin laxity or it is just extra fat. If you have skin laxity, then you require a tummy tuck, and if you just have extra fat and your skin tone is good, you can very well suffice with the liposuction also. The next question is by Mahesh Mehta, who asked me, how long is the downtime after body contouring surgeries? So Mahesh, that's a very variable time depending on the number of procedures which have been combined, and also to a certain extent upon the extent of liposuction or the extent of excess skin which has been excised. So it can vary from anything between 1 week to 3 weeks depending on how many procedures have been performed on you. The last question is by Rashmika, who asked me, are buttock augmentation and lift 2 different procedures? So when we talk of buttock augmentation, it essentially in today's world means the Brazilian butt lift, where we're going to be harvesting fat from certain areas of the body and going to be injecting it into your butt to give you a better appearance and also to create a kind of a lift. However, in some patients, especially patients who have had a massive weight loss, simply augmenting the butt using fat is often not sufficient, and we require to also remove the excess skin in the form of a surgical butt lift, where we're going to be taking out excess skin and there are going to be stitches involved in the area of the butt. So depending on what type of skin laxity you have, we're going to perform either simply a fat injection, or in extreme cases where a lot of weight has been lost, we would require to excise excess skin also. Hope that answers your question. I hope I was able to answer your queries regarding body contouring. If you found this information useful, please like this video and share and subscribe to my YouTube channel. Also, if you have any further questions regarding body contouring, please drop them in the comment section below and I'll gladly take them up in my next series. Thank you.